Good morning, everyone. Good afternoon, good evening, depending where you are. And welcome to this third session of the webinar of the Interagency Standing Committee Results Group 2 on Accountability MPSCA. And this is our session on accountability and inclusion in the COVID response. Lessons for the future. My name is Manisha Thomas. I am a senior advisor with PHAP, and it is my pleasure to facilitate this session today. I see that we've got some really interesting kind of words coming in around what three words come to mind, coordination being necessary, two-way communication, effective, innovative, adapting, complaint feedback. I think there's lots of things coming in there, and I encourage you all to keep adding there, and we'll be revisiting that later on today. As I said earlier, this is the third event in a series on strengthening accountability and inclusion. It's a series of events that has been organized by PHAP and the Interagency Standing Committee Results Group on Accountability and Inclusion. Sorry, I said the name wrong earlier in my introduction. I apologize. Our first event, which was back in September, we were looking very much at the current state of accountability, where we had a really interesting conversation, both from a global perspective, but also speakers and participants bringing in more examples from Bangladesh, the Philippines, and more. Our second session last month, we looked at more detail at some of the more concrete challenges that participants were facing in the area of accountability and inclusion, with a panel discussing how best to implement existing guidance around that. In today's session, we are going to be looking at what's been at the center of most of our attentions in the last 2 years. That's the response to COVID-19 and the response to the global pandemic. And in particular today, we are going to be focusing on the efforts related to risk communication and community engagement, or RCCE. We're going to be looking at sort of what lessons can we draw from this work during the pandemic that we may be able to apply to accountability and inclusion efforts in our wider humanitarian response. And thank you for all of you who are introducing yourselves in the chat. I see we've got lots of participation from around the globe. So that's really exciting. And I look forward to your questions and your comments as well throughout the course of our event today. We have a great panel lined up. I'm very excited from all over the world. I'm going to briefly introduce our panelists, and then we'll start with a few questions to them so that you can get a better sense of what they're doing in their fields of work and how they've been responding to the pandemic. But do feel free at any point, as Marcus said, to put your questions in the Q&A, or you could also put comments into the chat box. So firstly, I'd like to introduce Francis Amulin, who is the Community Engagement and Accountability, or CEA, focal point with the Uganda Red Cross Society. She's a beautiful Ugandan from a beautiful country, so welcome, Francis. Next, I'd like to introduce Emily Dwyer, who is co-director of EdgeEffect. Emily, I believe you're joining us from Australia, so I think it might be quite late in your day. So thank you very much for joining us. Emily is going to be also talking about how she's working on COVID as the co-director of EdgeEffect, and will tell us a little bit more about what they are doing and the organization. Next, we have Franklin Moliba Sese, who is the Accountability to Affected Populations Collective Service Coordinator in the Central African Republic, another beautiful country I missed seeing again, thanks to the pandemic, but welcome, Franklin, and hopefully, Franklin, your connection will last. Otherwise, we will not necessarily get to see Franklin the whole time, but hopefully the internet will be favorable to us today. Next, we've got John Warnes, who's the Innovation Officer focusing on digital inclusion with UNHCR Innovation. Welcome, John. And then last but not least, we are going to have Amaya Gillespie, who is the Risk Communication and Community Engagement COVID-19 Coordinator for the MENA region. Amaya is unfortunately going to join us a little bit late, but sure, we can bring her into the conversation when she joins us. So as I said, I'm going to ask a few questions to our panelists so you get a sense of what it is that they've been doing. and get a bit of an understanding of what their roles have been as they've been responding to the pandemic. So I'm going to turn to all of you first. I'll start with you, Francis, first, just to get a sense and ask you to all just briefly respond. But at the start of the pandemic, when there was a great deal of uncertainty about what we were facing and how we should best respond to the challenges at hand, briefly, can you tell us, what did you find was the greatest weakness in how the humanitarian sector was able to communicate with affected people and others about this new threat? Francis, if I could turn to you first, please. Francis, you're on mute for me.
Thank you so much, Manisha, for this question. I think for me, the great weakness was on messaging. The message was like very much centered on the virus and all the prevention measures, and a little bit less on people. Yes, there was a need to talk about the virus, that is a new disease coming, new world, the new pandemic, and to people to know also the prevention measures. But I really feel like we didn't do much on, at the same time, capturing people emotion and finding the way to address those emotions. We like make COVID-19 a star, but people, we didn't really focus on them. For example, yes, this is a new virus, and people was afraid about their life, about the life of their family, but we didn't really capture all those feelings of fear and how to address fear. And the prevention measures, think about the confinement and all the restriction of the movement. And people were really frustrated about all those measures, but we didn't really find a way to address all those feelings related to frustration. And I think the emotion was one of the weakest area of our intervention during COVID-19.
Super. Thank you very much, Franklin. And sorry, Francis, I realized that I was calling on you, Francis, but I didn't articulate well enough. I apologize. I think, Franklin, that's a really excellent point about the messaging and the lack of focusing on people. And I imagine the fact that we didn't know very much about the virus and what the impact was going to be probably also affected how we did that messaging at the beginning. And I think the other thing with COVID is that it's something that has affected all of us as individuals as well. So I think that point, about people being uncertain and that kind of fear of what it was going to be was also something that all of us also experienced. So I think probably also impacted what we were able to do in terms of our messaging as well as humanitarians. So I think it's a particularly unique experience in many ways, that it's affected everyone in very similar ways. Francis, if I could come to you from your perspective, working in Uganda, what did you see as the greatest weakness in how the humanitarian sector was able to communicate with affected people about COVID-19?
Thank you very much, Thomas. And thank you, members who are in the panel. Thank you, participants. First, I bring you greetings from Uganda Red Cross and Uganda in general. Taking into account what Thomas has just asked, we will all have to appreciate that the aspect of the influx of the pandemic and the general outbreak of COVID-19 took the entire country, the entire world by storm. There was largely no degree of preparedness, because the only thing that the general communities had to bench on was to rely on the health and medical descriptions that were provided towards the prevention measures and the control towards COVID-19. But we also have to appreciate that the general societal functionalities were all jeopardized in that the country had to go into a total lockdown. And that is not a phenomenon for in the African, the Ugandan way. People are used to living with each other, living in large numbers. So communities were disconnected because of COVID-19. And this meant that people were supposed to stay at home. And then the custom of putting on masks was something that was not the everyday take-home item, but as it was a real challenge in that the humanitarian actors in totality had to swim into action to bring the communities on board, talk to them, tell them the prevailing conditionality, task them to ensure that they put on masks, they have to wash their hands, they have to stay at home. And then that disconnection definitely has a transition that it has affected even the economic levels of the entire person. So apparently people are struggling, and this is an opportunity for us to bench into discussions. I know at the end of it all, we are going to have an index in this. Then the other one is the aspect of reaching the locality. Because if you look at the communication modes, the humanitarians had to face a challenge. What would be the most easiest and acceptable means of communication that could reach information to the people? Of course, we are aware there are still a lot of questions and facts as regards to COVID-19, but I know the parameters of the discussion as we go on, we will be able to bench on them. So Uganda is not any exceptional. We've suffered and are still suffering the same way. Thank you very much. Back to you, Thomas.
Thank you very much, Francis. Emily, from your perspective, what do you see as the greatest weakness in the humanitarian sector in our communication with affected people?
Thanks, Manisha. I should say, so EdgeEffect, for people who don't know us, we primarily work with LGBTIQ people, so on LGBTIQ inclusion within both humanitarian and development sector programs. To come back to something that you mentioned earlier, Manisha, I think there are aspects of this response and the challenge which were unique, but there are also ones which are devastatingly similar to lots of other crises and the way that the humanitarian system responds to particularly marginalised people. There's a piece of work that ODI's Humanitarian Policy Group did a year or two back, where they sort of pointed out that the humanitarian system is actually sort of fairly fundamentally bad at doing assessments of the kinds of challenges that people actually experience. So when organisations are doing inclusion work, there's a tendency to focus on women and girls, often meaning heterosexual and cisgendered women and girls, sometimes people with disabilities, and then it kind of stops pretty quickly without necessarily addressing those issues particularly well in the first place, but certainly without then getting to other marginalised groups that are within the communities that are being impacted by, whether it's a crisis, a rapid onset disaster, or in this case, a pandemic. And if you don't know much about people and their lived experiences, then I don't know, how do you design effective communications? How do you, if you don't understand their lived experience, the kinds of systemic factors which might be influencing their decision making? How do you design good RCCE programs? I think there's an extent to which I think with this pandemic in particular, with the messaging often sort of individualizes the responsibility, but the challenges that people are experiencing often, for example, people who need to go to work, even when potentially maybe they shouldn't be going to work or shouldn't be travelling, are systemic. And so I think with RCCE, if it's going to be more than a band-aid, then we need to have far better situational awareness of the diversity of people that are being impacted by something like the pandemic, so that we can understand the information ecology better. We can understand the different reasons why people are making decisions, and I guess there's the short-term and the long-term dimensions of those problems.
Super. Thanks very much, Emily. And I think Francis and Emily, you both highlighted, how do we really consider the context where people are located? What are their experiences? how do we make sure that we really understand what's the best way to communicate with them, I think is an important, and yet as you mentioned, Emily, a challenge that we've also faced otherwise, not just in COVID, but probably became much starker during the COVID response. Amaya, I see that you have joined us. Welcome. I'll give you a couple of minutes to get into the group of this, and I will go to John first, although I don't see John. I hope I've not lost you, John. There you are. Sorry, my screen is not big enough to see everyone. John, from your perspective, what did you see as the greatest weakness in how the sector was able to communicate with affected people about COVID?
Thanks, Manisha, and thanks, colleagues, participants. From my perspective, digital readiness is probably one of the biggest challenges that we face. There are reasons for this. I think that if you look at information ecosystem assessments, information communication needs assessments that have been undertaken more often than not, you see face-to-face as one of the primary sort of communication channels. People like to talk to people face-to-face. However, obviously, when physical distancing measures were put in place during the height of the COVID pandemic, a lack of digital readiness was a challenge for many organizations who had previously fallen back on that preference. And I think that what this really does is emphasize the need for not only us to take the preferred channels of communities, but also to have multiple channels available to us. And often what we found in COVID was that actually communities were much more adaptable than the humanitarian organizations when it came to the types of communication channels they would use to talk with one another. And we need to get better at that. We need to be able to get ready to be able to utilize these channels as community preferences evolve rather rapidly due to the challenging circumstances. And those humanitarian organizations who'd invested more in digital infrastructure regarding the communication channels they would use to support their work around accountability to affected people were better positioned to adapt and to the complex and fast-paced changes that COVID-19 brought about. And there are many, just linked to this, there are many who maybe think, well, what about those communities who don't have access? There are actually approaches and strategies that can be taken to advance digital inclusion to ensure that those who are left behind may then get access to devices, may get access to digital communication channels, because for them, there weren't really many alternatives. So it was a bit of a pivot, and it was interesting to see how that area of risk communications, community engagement intersected with the need to enhance digital inclusion of communities in this circumstance.
Super, thanks very much, John. And I have wondered many times, we've been very lucky with the digital access and communication that we do have in 2020 and 2021. If we'd had this pandemic many years ago, it would maybe have been much harder for us as humanitarians to even adapt there. But I think that point about how we're not as quick as adapting as communities are is something that I think we do need to learn from, for sure. Amaya, from your perspective, and welcome again, what did you see as our greatest weakness from a humanitarian perspective in terms of communicating with communities? I can see you're looking for the unmute button.
Unmute, yeah, exactly. Yeah, my screen had other things on it. Thank you, and hello to everybody. I'm not sure I can add very much to what has been said in that regard. I mean, I've been thinking a lot about some of the solutions that we have been reaching for. But I really liked, Francis's points right at when I joined, Francis was speaking, I think at the beginning there, just sort of setting the scene. And I think it's an interesting point about we were caught a little bit off guard, of course. At the same time, I feel like we could be forgiven for not predicting how big this thing was going to get. I think, yes, there was preparedness in place, but it was nothing close to the scale that this has reached. And it's true that we did have plenty of warnings from international public health from lots of different corners, but it taught us a really big lesson rather quickly. And the other thing that I would say also about the comments that Emily made and also John, that I think yourself too just now, Manisha, that when we were working, I was in West Africa for the Ebola epidemic, didn't quite make it to pandemic. And Ebola really, if it gave any sort of gift to public health and risk communication, etc., and social and behaviour change, it was the emphasis of community engagement. Before Ebola, no one really took it seriously, and we were very, a bit slow to get serious about it. But nobody could deny it as it unfolded. Nobody could look away from the need for community engagement. And I think that's the thing that we started with. Again, we can always be done quicker, but we had that recognition coming into COVID, and definitely the donors recognise that. There's a very different funding environment for that demand side. So I think that certainly made a huge difference. And I think if COVID has given us any gift, it is on the digital side, as John said. I do think that we're taking that much more seriously, particularly around, say, social listening. Of course, the elephant in the room is that we haven't managed to contain the impact of social media either. We haven't managed to use these algorithms to our advantage so much. I think, yes, we have been able to use it, but it does feel like they got away from us a little. So maybe that's an area that we'll get better at. Over.
Thanks very much, Maya. And I think that, that point about how we're able to use social media and really understand how to manage it, I think is something that we're all trying to tackle. And I don't think it's exclusive to the humanitarian community by any stretch of the imagination, as we see what governments are struggling with in terms of vaccination uptake, for example, or just even the facts or non-facts that are being circulated. And I think that's also probably having a big impact also on how we're able to get information and to communicate with communities. And I think that the truth versus fiction is something that we're all struggling with. And I imagine that is going to be something that maybe we'll hear a bit more from you as I ask you my second question to all of you. Given those weaknesses that you've all identified, have you seen any improvements on the points that you raised? And is this likely to impact the way we conduct our responses moving ahead? Like looking back at what we've learned in the last almost 2 years, how are we going to be responding differently perhaps in the future? Maybe I'll start again with Franklin and then go to Francis and go the same way I did before, if that's okay. Franklin, please.
Okay, thank you, Manisha. I was talking about the people emotion, and in our case, we came in the point where people was frustrated and hungry and angry, and they start that form of attack, direct attack to social mobilizers in the field. So we needed to act to course correct the way we are conveying our message. So we did it at 2 levels. The first level is in the training of social mobilizers. So we train our social mobilizers in the field to use the active listening, but listen in the way not to respond, but to also hear the emotion of people, to validate the emotion of people, and then to convey the message. Not just come and say COVID-19, wash your hands, social distancing. No, you engage in the way that you people can feel like you are sharing the pain, you are sharing the emotion that they have. The compassion was a key word. So in the training was really trying to help them, to give them tools, not only to hear, but to convey the messaging in the way that people can really feel like we are sharing the same pain, and we'll go through this all together. The second level was at the message development. I was developing our message. In the second batch of our key messages, we make sure to have at least one theme on all the emotion or the compassion, how this is a challenge for us to show compassion and to lean one on another and to make our effort and to come together, even though we need to be socially distant from one to another, but we need to work together to get through this. And this message was conveyed in the radio, through social mobilization, and in all our platforms. We call it message de sympathie. And yes, and we start seeing some improvement because the rate of attack went a little bit down. Our social mobilizers were not attacked as we did see it at the beginning, quite every day. So I think that is, for me, one of the key areas that we need to improve. I know that we still have a long way to go on this, but that is an area we need to improve in, showing compassion. That is the sense of our humanity, which is also one of our core humanitarian principle. I think for me it is a key point. And from there to now, even all in our training and training curriculum, we try to put something on active listening, how to capture emotion, how to share compassion, the sympathy. All those things need to be in the learning learning curricula. The training curricula for the social mobilizer, even with the journalists, we train them on how to share those emotions on radio show, etc. So that is how we go about this issue of emotion, and how we try at least to address this problem that we faced in the field. Thank you.
Super. Thanks very much, Franklin. And I think we've probably also had even more challenges. The fact that a lot of us went digital, I think we've all recognized it's not quite the same having a conversation with a person in 2D as it is in 3D. And I think really trying to adapt to how do we make sure that compassion and that active listening is there has been made even more challenging. But I do wonder also, is part of that problem, as you mentioned, the principle of humanity should be behind everything we do. Have we lost some of the kind of fundamentals of what humanitarianism is about as we've really tried to professionalize and standardize the system, and we've created lots of guidance? Have we maybe made things a little bit too technical that we're forgetting a bit the heart of what humanitarianism is about? That might be a bit outside of today's topic, but it does sort of strike me, Franklin, with what you said, that maybe we need to be thinking again around how do we make sure that we do have the principle of humanity at the basis of what we're doing, which also comes back a little bit, Emily, what you had said earlier around, do we really understand people's lived experiences and how much effort do we make to understand that? Francis, I'm going to come to you and ask you have you seen any improvements on the points you raised earlier, particularly in terms of the reaching localities and other elements that you discussed around our weaknesses in the sector?
Okay, thank you very much, Thomas. First, I would like to share with all of us that Uganda Red Cross is the leading humanitarian actor in the country. And as soon as we went into the breakout of COVID-19, we as a national society are spread all over the entire country, and quickly had to preposition a number of volunteers at points of entry. And the points of entry, we looked basically at the border points, including the international airport of Entebbe. And the volunteers had to swing into action to begin conducting social mobilization to the communities. And we had to borrow a leaf from the responses that we had already done during Ebola and also during the cholera outbreak. And we used the same experiences to venture into mobilizing communities. But you'll also remember that, yes, we're leading humanitarian charity in the country, but we work with the government of Uganda, and principally work with the respective ministries. And the mother ministry here is the Ministry of Health. So the Ministry of Health undertook the responsibility of conducting the technical aspects, and the Red Cross volunteers remained to mobilize communities to relay the messages, the medical messages that were being given by the health teams, which were targeting the prime one on the basic observance of the SOPs for COVID-19. So this was done door to door, because remember there was curfew, and then there were elements of saying people should stay at home. So our volunteers would move into these communities and speak to the people and tell them the very basic facts about COVID-19. And then what was unique in this is that we had to undertake identification of suspected persons who had contracted COVID-19. And then the instruction by the health teams was that the persons who are suspected to have contracted COVID-19 should be taken to the nearest health unit for checkup. And then consequently, the recommendations would be either isolation or home-based care. But of course, home-based care has come in very lately. But in the first times, you have to ensure that the people are kept into the quarantine for the mandatory days, and then a repeat check, and then they would be led to get to integrate with the community. But even before they did the integration, again, our volunteers in Uganda Red Cross had to offer a lot of psychosocial support, because there was a lot of desperation. The multitudes of persons who are dying day by day, there was hope was lost, and everything was in a mix. But the beauty was the resilience that was created by the volunteers as they moved to the communities, and also the facts that they were given, and then the precautionary measures that were being relayed by the ministry of officials, alongside helping to do contact tracing, and then also to ensure that the persons who are believed to have contracted the virus were not to stay at home, because they will eventually pass over the virus will be easily transmitted when people stayed at home. So looking at the bigger picture, the transition in which the robustness of preparedness and the response activities that have been underlaying, with all the effort that we get from the Ministry of Health, I am glad to share with you that as a country, we've even prepositioned 16 ambulances countrywide, which are responsible for pickups of persons that could be suspected, so that they are taken for checkup, and then they are either looking at the medical report that comes out, is when it is decided whether the person stays in an isolation unit or the person is attended to when he's at home. So principally, that is the effort that we are using as a national society. Thank you very much, John.
Thank you very much, Francis. And I think really the way that you've been able to work with the Ministry of Health, I think, highlights that real interaction that was required in many countries of humanitarians working very closely with ministries. I do see we've got some questions. I know, Amaya, you're going to answer some of the questions in the Q&A, but we've also had a few people post some things in the chat. We've got Julie, who's picking up, John, on your point of information ecosystem assessments that have been taking place in the last year, where Internews conducted several, one specifically looking at COVID communication flows for LGBTQI plus Venezuelan migrants in Colombia. And also, Manal has pointed out one of the challenges that humanitarians have faced in communicating with communities is denial, where many people kept saying there's no cases in our country, and it's something imposed by the government to gain access to funds. And that mistrust being a big challenge that affects how they've been interacting with precaution measures. And so maybe when I come to the rest of the panel, if you maybe have some thoughts or any reactions or ways that you've responded to that issue of the mistrust that was out there. And then another question is also, how much did simply the dominance of COVID in the public communication flood the minds of people with rules, regulations, prohibitions, and instructions? And that fear, how much did it influence our ability to engage with communities with compassion and a vision forward? Emily, maybe from your perspective, you can tell us about any improvements that you've seen on the points that you raised earlier, particularly around understanding people's lived experiences? How are we really figuring out how to communicate in the ways that people need? And do you see that impacting the way we're going to conduct our responses moving forward?
Sorry, I can contribute a bit there. In particular, I guess around the LGBTIQ inclusion side of things. And I think one of the things that has happened is that we've started to have some conversations about the topic, which we weren't having before. So I think one of the impacts of COVID-19 is that the marginalisation of LGBTIQ people has become more visible. It's become more talked about within the aid sector, and so that's a good starting point. For example, Australia's Department of Foreign Affairs and Trade commissioned us to do a report about the access that LGBTIQ people have to cash-based assistance within a COVID-19 context. And I don't imagine that would have necessarily happened if there wasn't this feeling that we needed to address COVID-19 in a way that did actually include all people, and sort of move beyond some of the rhetoric around that to some of the reality around that. I think the paper that was linked in the chat from Internews is a really interesting example of that. I think Internews also put out I think a sort of one or two page guidance note on for journalists and for people communicating with LGBTIQ people during the pandemic. And this is sort of some of the first times within an RCCE context that we've seen in this kind of guidance. I should I used to work for Internews some time ago. So to sort of put that, we're not sort of spruiking any particular organisation, but I think it's really interesting to look as that paper that's linked in the chat does about, for example, the kinds of trust issues that LGBTIQ people have. So when the media in your country tends to either ignore you or use you as a punchline for jokes and dramas, or to demonise you, then your willingness to trust information, or even pay attention, is often going to be limited. When you don't expect that those official information channels are going to address the kinds of needs that you have because they never have before, why would you pay attention? When you're faced potentially with situations where people are blaming the pandemic on LGBTIQ people, we spread the disease for a variety of reasons. Why would you then engage? And so there is a significant temptation, I think, for some LGBTIQ communities to withdraw in that context. In that context, community-based response has been absolutely critical, and community-based organisations, a lot of LGBTIQ human rights-focused CSOs, have had to pivot dramatically to provide support for their communities that that governments and other organisations are not providing, and some of that includes distribution of food through kitchens. Some of that includes distribution of cash. So some of that includes providing information from a trusted source, or information which is more relevant to people, maybe is more relevant to their experiences of the health system, maybe more experiences to their concerns about if they are a person who is undertaking an HIV treatment. What does that mean? And there's lots and lots of concerns that people have. There's a report that was put out by Outright, which is another organisation which has done some research into the COVID-19 context, where one person said, look, a transgender person is not going to go to hospital because when they go to hospital, they don't know which ward they're going to be put in. They don't know whether they're going to be treated well. They don't know whether they're going to be isolated from their community and people they trust. And so why they're just not going to put themselves in that context. And so understanding all of those reasons that people have, going back to that idea of lived experience, of exclusion, of discrimination, of people not caring very much, you kind of need to really understand that, then to understand, well, how does information then flow through those communities? How can you build that trust? How can you make sure you're actually addressing the issues that are worrying people, or that are potentially holding them back from accessing services, or following messaging that you might want them to follow.
Thanks very much, Emily. And I think that it links a little bit back to what Franklin was talking about, that active listening, really trying to understand what people are going through, what their experiences are, what information they may or may not trust. And I think coming back again to how do we bring that sort of humanity back into the humanitarian work we do is an important element there. John, from your perspective, and you were talking a lot about sort of the lack of our digital preparedness and digital sort of savvy or adaptation. Have you seen any improvements around that? And is it you did mention a little bit how it's gonna change the way that some organizations have been able to adapt, that they've been much better at it. Do you see it being a much more broadly learned lesson that we can take forward? And sorry, just to also add, and I'll point it out also, another element around the inclusion of people is around people with disabilities and developing methods, tools, and ways to share information with them that's relevant. And John, maybe you can also speak to that in terms of lessons around accessibility of our digital messaging.
Thanks, Manisha. And some really great points from Emily there and Franklin before. And I might actually build on a couple of those as well in my response. So it will be threefold. The first will, just to say with regards to digital solutions, I think that there has been some improvements. But in some sense, it's kind of happenstance in the sense that many organizations have been pursuing this, relatively gently over the last 4 or 5 years. And at that point of acceleration was really the COVID-19 pandemic, when it clicked and everybody realized, oh, this isn't a nice to have anymore. We need this. We need to have this as part of the mainstay of what we draw down upon with regards to our risk communications, community engagement approaches. We've seen this being prioritized at relatively senior level in the humanitarian system with, for instance, the Secretary General's Roadmap for Digital Cooperation, other initiatives aiming to bring humanitarian and also private sector actors together around the importance of digital, and with commitments to invest significantly larger sums of money. These are all in their early phases, right? So will that, manifest in time? Only time will tell, I think, in some respects. One thing I think that does appear kind of clear and maybe hasn't come forward yet is how this then trickles down to country level or specific coordination platforms. And while we know that over the course of the last 5 to 10 years, there have been challenges with regards to risk communications, community engagement coordination, this then doubles up when it comes to digital because of how it intersects with so many different areas of humanitarian response beyond purely the communication and accountability to effective people agenda. So that will become something more challenging, where humanitarian organizations probably have to think more through how that is coordinated at any particular situation or country level. With regards to inclusion of people with disabilities, I think we are seeing more cognizance around this. We've seen organizations like the GSMA extend programs around accessibility. Our team in UNHCR have a more focus on this, which has been amplified by the pandemic. The sort of leave no one behind mantra needs to apply to the digital as well, and we need to take that forward and be cognizant of these needs. But it's still very early days with many solutions, and I commend this webinar for having the functions like captioning and so on in place to ensure that it is fully accessible for all. Maybe we can talk a bit more about that later on in the webinar. The last thing, just building on Emily and Franklin's points, I think in terms of improving practice, is we have seen sort of nascent moves forward with regards to how we engage with communities using digital channels. There have been sort of advanced approaches to how we may be using contact or call centers, and including specifically social media. Actually, a shameless plug here. The UNHCR developed a guide for using social media to support community-based protection, and there's some really good examples that sort of build on exactly the points that Franklin and Emily were saying, where you can be proactive and compassionate in your digital engagement. Just because it's digital doesn't mean it's purely transactional or so on, but you can build these types of engagements with people that really are more substantive, and that contributes to some of the points in the chat around persuading, change people's mind, be proactive in engaging these communities to build that momentum around positive messaging around COVID-19 and beyond. So I'll stop there and we can talk more on some of the other points later.
Thanks very much, John. And I do think lots of organizations like PHAP have been really helpful in terms of ensuring we've got that accessibility with captioning and even also interpretation. I think has been another really, as a gift, I guess, from COVID, that we've been able to see much more engagement. And I think just even being able to hear from people much more readily from all over the world, I think has been another little gift from COVID. Maya, I see that you're going to be answering quite a few of the questions that have come up in the Q&A, so thank you for that. I don't know if you're doing them all right now, but some of them have been very much around sort of, you already answered one a little bit around what good lessons do we have from Ebola or also HIV/AIDS. Don't know if you've got a little bit more around that for RCCE. Also, how do you deal with a strong vaccine hesitancy at the community level when it's coming to vaccines from China? And most of the time, it's the only vaccine available on the ground for affected populations. And that's a question from Sunny from experience in Myanmar. And related to that, UA has asked also, we should discuss how we address the demonization of vaccine hesitance in some communities, replicating some of the deep divisions that the question of vaccination has caused in northern communities, led by divisive media and politics. And there's also Shahidullah is drawing kind attention to Francis as a solidarity response against COVID-19 by WHO, IFRC, and UNICEF. But as far as I know, IFRC was mainly working on strengthening national societies. And if national societies respond, complexity and threatened volunteer life was hired with fraudulent activities, whereas IFRC updated their platform with apparently 75% invalid data. I don't think, Amaya, that's one for you, but we'll come back to that question. But Amaya, really some of the lessons that you've seen, one you've already mentioned about Ebola, but also in some of those other weaknesses, have you seen improvements that are going to help us impact how we respond more generally in the sector moving forward?
Right, so where to start? But maybe I'll start with just what was just said from Franklin and John about how you can make online communication warm and empathetic and compassionate. I mean, if you can find a husband or a wife or a boyfriend or a girlfriend or something in between, then sure, it's definitely possible, right? So I think we are very formal still in our communication, which doesn't help. But I think we've also seen several agencies sort of loosen up as well as we've through COVID. So yeah, there's a whole range of things there. I guess the main thing I wanted to say, particularly to the problem of having only a single vaccine available and people not wanting to take it. You know, the short answer is you ask people, you know, what's it going to take? The second thing about that, and that's what everyone else has been saying, so just reinforcing what others are saying there. But the other thing to say about that is it just takes time, because actually we've seen in this region, in the Middle East, North Africa region, Eastern Mediterranean as well for WHO, we have seen that change over time. And again, using social media platforms, we've seen much less chatter around it was basically about side effects, let's face it. And some vaccines got off practically scot-free because the other vaccines were getting so much attention for side effects. So, you know, it's no reflection of the reality of it. But I do think we have seen over time that has changed. The second thing that has had a really big impact here, and again, this is not anecdotal, but it's observational, let's say. These things are difficult to prove. But what we're seeing is in this region, we had practically no vaccines. And then we said they were coming, but they didn't. You know, it was unreliable. So we broke a lot of promises, and this sort of undermined the trust, of course. But within that vacuum, we also saw a lot of misinformation come in to fill it. As the vaccines started to arrive in the second batches we've just seen over the summer, we saw a lot of what had been called hesitation. I don't want to say it was automatic. It wasn't, because you know, we also had to push very quickly into the programming side. But we do see a shift as you see this rise of what is becoming a social norm, right? We're trying to create this norming effect. So I think for all of that to say, there's a lot of supply side issues. there's a lot of historical issues that are actually affecting us that you can't get rid of them. You know, when we still have politics going on as well, which again undermines the trust. But on the demand side, you can develop trust, and really asking people is the main way to do that. And I don't want to minimize the challenge there, because it is an enormous challenge, but it doesn't go away quickly, that particular one, which is different from countries that have lots of vaccines, and then they still have that problem of some people only want to take a certain vaccine. But that has different possibilities. But we have just in short seen countries actually have some success with that, and it's basically by showing people taking the different vaccines. And you've got to show the right people taking the vaccines. It's not just about politicians, it's not just about celebrities, it's not just about religious leaders anymore either. It shifts and changes. So I did mention about a little bit about Ebola, but also I had actually worked in HIV for a very long time. And, you know, that's really, I was going to say that before we've forgotten that HIV is, not was, but is a pandemic and as well. And really, that's where we got the whole nothing about us without us from. You know, that's where the whole idea of community engagement came into being, really, as a global sort of impact, where people actually affected by the issue were brought in to look at the solutions. And I think, you know, that really did make a big impact on public health, but also a lot of other institutions. But I guess, of course, we could go into specific strategies, you know, using behavioural insights, and, you know, that my background is in behavioural science. So that is my instinct, but I don't think we want to go to that kind of level. And also it's a bit presumptive, because actually each country, within countries, you've got different situations, but maybe it's a whole nother webinar. But just in short, to say, in this region, we're in the middle of doing a time series of the 23 countries in our joint region with WHO, UNICEF and WHO, 23 countries study simultaneously looking at behavioural factors. So we're able to see a kind of similar patterns across the region, but we're also able to see some distinctions when we look at country by country data sets, even though I hasten to add some of those are quite modest sample sizes, but still we can use that to triangulate. And so from that data, probably one of the most important things that we see, and perhaps this is getting to your questions, Manisha, about innovations, is, you know, as public health specialists, we've been good with data, but we're actually seeing a lot more behavioural data in COVID. And this is also a first to see it on such a big scale. But the real innovation, because, you know, that's not new, we knew about it, but it's much widespread. The real innovation is actually how we analyse it. So as public health specialists, we tend to, you know, do the descriptive data, 20% of this, 40% of that, you know, disaggregate by male, female, other genders, age, etc. And we think we're doing well. And in fact, in a lot of countries, we are doing well if we can get that far. But what we are doing now with COVID data, and we're doing that in this region, is we're developing those personas. So instead of doing just the descriptive level, we're actually looking at all of the determinants by vaccination status, if you like, or category, or typology. So if you are vaccinated, you have a very different view of whether COVID is severe or not, if you get it, how susceptible you are, etc. We're seeing these patterns across the region, and largely true country by country, with, you know, some variation. If you're highly resistant, what we have called hesitant, or even worse than hesitant, they have a different view on these factors, and we see like very distinct patterns. And in between, we have a tiny group in our region that is undecided, like 5 to 6% in most countries. That's the average. So most people have decided. But what is really stunning about this data is that ourselves as specialists in the field, working in the field, we've talked about everyone who's not vaccinated yet. We talk about them as if they are against vaccination. And what this study has showed is they are not. They are just not yet vaccinated. Across the region, our region, Middle East, North Africa, and Eastern Mediterranean, 60% of people say they intend to be vaccinated. Another 15 to 20 are already vaccinated. So we have a majority who are open to vaccination. So I think this is a really important thing for us as the people, in the engine room, to be very careful about how we label people who are not yet vaccinated, because in fact we could be leaning on an open door. People are willing, but they're waiting. And I think that's about, there's some sort of steps to that. First it has to be accessible. And we know that for some people, they just can't get it. There haven't been vaccines, or there's one or two sites, or it's a long way away, or you have mobility problems, or there's gender factors where your mobility is limited by other factors. You have to make sure, secondly, that it's beneficial, but it has to be beneficial on the terms of the community. And different communities or different people, even within that group who are intending to be vaccinated, different things appeal to them. We have to have multiple responses to that. It's not a single response. That's, I think, another error. We want one response, but actually it's multiple, local level. Just thirdly, it has to be convenient, but again, it has to be convenient in terms of the community. Fourth is, it needs to be something that's desirable, or that, truly demand driven. People need to come to that. And ultimately, normative. And, we could talk about mandates, but mandates shouldn't be the first thing. There should be something that reinforce a norm that's already well on its way. And I think these sorts of steps is what we need to think about when we're putting our programs together, and this idea of going quite local and asking people, to see where they are on this sort of ladder to being vaccinated. So I'll stop there. Over.
Thanks very much, Amaya. And I think that issue that you just mentioned around, how we label the unvaccinated and the lack of sort of equal access to vaccinations has been a major challenge throughout COVID. And I see we've also got Getchu, who's asked or was pointed that out as well, is that COVID's a global problem requiring a global solution. However, the distribution of vaccine percentages, when you compare them from developed countries to developing countries, like in Africa, is 80% to 2%. Now, what's the role of humanitarian actors, or what could the role, or should be role of humanitarian actors be in advocacy to address this unfair distribution? And I think that lack of the COVAX working as effectively as I think was initially hoped has been a huge challenge. And the lack of getting vaccines to places is something that we also need to consider. And I know there's many that have been trying in the humanitarian community to be furthering COVAX. That is the right name of it, right? It's morning here still, and I'm still on my first cup of coffee, so my brain's not fully functional. But I do think, how do we make sure that we've got that access to vaccines that everybody needs is an important one. And thank you also, Maya, for bringing back those lessons that we have been and continue to learn, I think, from the AIDS pandemic as well. I think moving on, we've got some other great points, and thank you, John, for dropping in a link, as well as Catherine, to everyone around using social media in community-based protection, a guide. So thanks for that another UNHCR guide. There's also a question around, have there been improvements on translations in making information accessible to communities, as this has been a gap in most responses from a humanitarian perspective. So I'm wondering if maybe some of you can speak to that one. And there's also a point about how the best campaign for vaccination is leadership. And in previous experiences, when we've had leadership campaigning for vaccinations in the Red Cross movements, IFRC's job is to strengthen national societies. So why not initiate some transformational leadership for national societies by IFRC? And then a helpful innovation in COVID in the US before was very sketchy and occasional crisis response in the faith and community engagements, the former points of light. Now there's cooperation with weekly reporting by reps and government agencies about progress and failures, with 1,000 local humanitarian coordinators. In the US, it has led to calls to enter into appropriate responses. It leads, I guess, to calls for appropriate responses around the shortfalls, including with vaccines for refugees in shortfall areas like Gaza and the developing world. And a whole new level of ISC clusters has formed to make more rapid admissions corrections. There were promises to send money, and vaccines were very slow, but accountability has been increased. And we've also got another few questions that are coming in about how COVID's affected the world economy, but the wage bills remain the same. And I think, that's also been a big question around how the wealth distribution that we've seen, how the rich have gotten even richer during COVID, and yet essential workers have been at the front lines of this response, as have humanitarian workers. But in many countries, healthcare workers are not necessarily receiving great wages, nor are those working in grocery stores or in pharmacies, those that are there having to go to work every day during the pandemic, not being able to do online meetings like many of us have been able to do. And Alan's also asking here, how can I from a least developed country be rescued from poverty? Others are eating, there's no food, there's no vaccine. And Emmanuel's also asking about how do we talk about achieving herd immunity when the vaccines are not available in large quantities, especially in developing countries, for example, like Ghana, and how do we deal with that? And I think, there's a lot of that sort of inequity that we've seen in COVID times and in the responses and that wealth distribution. And I'm wondering if any of you have sort of been able to address that in some of the communications that you're having with communities. Is that inequity an issue that's had to be addressed in your community, your communication with communities, or is it something that Franklin, as you said at the beginning, around some of that compassion and hearing people and that anger that was there, is that something that's come out? I also have another question that we got in advance of the session from Nanlanha, and I probably pronounced that completely incorrectly, so I'm going to apologize right now, from Swaziland, who's wondering around how working in a country facing other disasters or political unrest has affected your approaches to community engagement when it's come to the pandemic, which may seem less tangible than other issues that people are facing in a country. So how do you really communicate about the pandemic when people have bigger concerns, which could be the conflict that's ongoing or a disaster that they've been affected by, or it could just also be the fact that they are living in poverty and they don't have access to food or vaccines. Has that been something that any of you have seen in terms of your responses, and has that sort of affected how you've been communicating with communities? Franklin, maybe I can come to you around, there's a whole lot of questions there, and I know you can see some of those questions if there's any in particular that you want to come back to, or also how you've sort of seen, particularly working in CAR, how the prioritization of communicating around COVID has impacted the work that you're doing.
Yeah, thank you, Manisha, for the question. In CAR, we are in the country, this is the country in the crisis, the war is there, and the social issues also there, the poverty and all those problems. So what we saw here and we continue to see here is not about employment, because the country, many young people here are under employment. They are not employed, so they are trying their best in every day to do small job and to pay for the living for their family. So now the impact of COVID was that because of the restriction of movement, the only way all the import and export with the exchange, commercial exchange with Cameroon, so the main road was blocked. So the cost of life was really skyrocketing in the marketplace, for example. So, for example, to find sugar, salt, all those good that they need, but they imported from Cameroon, they was not able to bring those goods in the country. So the situation was really difficult. So what we have done with a humanitarian community was to not only focus on COVID, but try to mainstream COVID in the overall response. So when we are doing WASH, when we are doing food security and everything, we need to put COVID in it. So that we can go back and not only talking about COVID, but when we are talking about distribution, the distribution in the camp, for example, we teach people the social distancing when we are doing food distribution, for example, in the camp. For example, when we are doing the WASH implementation, the WASH and the cash at the same time in the community meeting, we try to convey the message while we are doing our everyday business. So the strategy here was to mainstream COVID-19 throughout all the response. And when we are providing the response to the key issue, because the main issue here was how to find food, how to find water, how to find care, health care. So all those things, when we was providing them, then at the same time, we convey the message on COVID. Because now people was really seeing COVID as a block road. In their life, because of COVID, they cannot go sell, they cannot go do the small business. So everything was like stuck. So that is the strategy that we put in place here in the humanitarian level to respond to COVID, not only to bring it like a single issue and we need to address COVID, but to bring it in the overall problem of the country, putting emphasis on the key issue, but at the same time, talking about COVID, conveying the message on COVID. That is what we did. And I think we got in the regional level, we got a really nice result here. The rate for COVID vaccine uptake here in the country is the highest of the region, because we try our level best to put COVID to put at first what people need, and then to bring COVID with it. All the messaging, all the vaccine, masking, all those things comes when we are doing what people need first, and then COVID can pass through as well. Thanks.
Thanks very much, Franklin. And I think that sounds like a very logical approach to be able to get people to really be considering how to uptake the needs and what needs to be done around COVID. Someone, Hamza, is asking, how can we deal with the celebrities or influencers who are anti-vax, who are sharing their ideas freely on TV, radio channels? I'd also add social media, and they can have a huge influence on people. I think that's another one that maybe would be helpful for us to unpack a little bit. And then also Shahidullah is also saying the first vaccine developed from chickenpox, which was overcome 150 years, and next all past history of pandemics happened. Same things repeated where available solutions are available, but it seems a bit of ADHD of leadership not to remember how we've dealt with things in the past because of a lack of delivery and receiving if there's not a balance when the cases of misinformation arise. I think this vaccine hesitancy one is also, or how the anti-vaxxers or celebrities and influencers are talking about, a lot of not necessarily truths around vaccines is an interesting one. And I was listening to a Jon Stewart show the other day with Maria. Oh, now I've forgotten her, the Nobel Prize winner recently of Rappler in the Philippines. And she was saying, with social media, we have this constant battle of things that are being put out there on the internet and being taken as truth, even though they're not. And where journalists are fighting to put out, and scientists and leaders are putting out actual facts, it becomes fight. But thank you, Maria Bresa of Rappler. Thank you very much, Isa, for helping me with that name. I told you I haven't had enough coffee this morning yet. But I think it is that, how do we really manage sort of a lot of the untruths that are being sold out there versus the science and the facts? I think that's a struggle. And how does that come across when we're doing that communication with communities? I think, Emily, you were saying before, what are the media sources that people trust perhaps or don't trust? And how has that trust really impacted the way that humanitarians are communicating with communities? I know, Francis, you had some thoughts also around this in particular, but around working in a country as well where you've had an ongoing refugee crisis, you've had other disasters. How has that affected the way that you've approached community engagement on the pandemic response when it may not be as tangible as other issues people are affecting? And also, how have you sort of dealt with some of the untruths that are out there? And Fiona's got a recommendation. We just get rid of Facebook. I think it's not only Facebook these days. I think there's a whole string of social media that would have to go along with Facebook. But Francis, maybe I can turn to you for some thoughts also around any of the questions that people have been posing for us. Yes, Meta, John, you're right. No longer Facebook, indeed. Francis, please.
Okay, thank you very much. I'm going to request Marcus to share my screen so that I could make a mention on our effort towards the use of the digital platform. From the Ugandan perspective, we have endeavored to bench into establishment of risk communication and community engagement dashboard. And here, particularly our interest is to ensure that we use this platform to be able to collect rumors about COVID-19, any striking questions. And in this process, when we do an analysis, usually which is routinely on a monthly basis, we are able to make extractions to be able to find out and be able to make plans so that what would be the best ways we could respond to the questions that are coming out of the communities. And then for also us to get their perception about the prevailing conditionalities of COVID-19. And in the same process, we also use this dashboard to inform decisions that are undertaken, especially when what is trending at the moment is the aspect of vaccination. But we will remind the members in the discussion that Uganda Red Cross has not worked in isolation, like I said earlier. We are working again together with the medical teams, yes, who are providing the technical support in the actual vaccination. But as humanitarian actors, we resolve the aspects of the rumors, like the targeted thoughts that the COVID-19 vaccine are not going to make people to produce, they are going to make you academically retarded, and all sorts of rumors that are associated with it. So in that process, our statistics, which are standing at the moment, openly show us that the turn up for persons coming for vaccination is high, and for us this is a good indicator. But the disparities, I will ask workers to unshare my screen. We will have to appreciate the disparities that we have, like Franklin has spoken a moment ago. I would like to pick a leaf from his presentation, in that if you look at the rate of which the young girls, especially those below the age of 18, have conceived during this lockdown and the occurrence of COVID-19. And this is deliberately going to affect their schooling schedule. And at the same time, they're also producing babies of babies. So even the question is, these children who have been produced by fellow children, at some point we should have a think tank to pave a way so that they are brought to terms with the underlying factors, but also there is getting a baby, but there's also catching the virus. So in the case that the person has also caught HIV virus, and as humanitarian actors, what preparedness do we have for that matter? And then the other one is looking at ailments that persons have already, people are living with ailments of different levels. The consequences of COVID-19 made people even who were taking their ART therapies for HIV skip medications because the curfews were not allowing people to, the travel ban given to people all over the country to not allow them to pick up their medicines. This has impacted on their health, and you realize that, again, like Franklin says, we need to take up the aspect of COVID preparedness and response in a holistic manner. We are not only going to look at what is trending, but we need to get back to the very bottom and give ourselves a pre-think what has gone wrong and what can be done better. So I thought, looking at that, our participation was particularly to ensure that the communities also get a chance to have their rumors and any striking questions answered so that they get the basic facts about COVID-19 and for them to be participated in the entire process. That's why the volunteers that we have are working with what we call village COVID task forces in a very smaller unit of the village. Over to you, Thomas.
Thank you very much, Francis, and thank you for sharing those experiences with us. I think that's also really helpful to get that concrete sort of way that you've been addressing it. Emily, sorry, I wanted to maybe shift a little bit from that question around the bigger issues, but also to kind of focus a little bit on inclusion, as you've been talking a little bit around that. You know, you've mentioned some of the challenges around inclusion and how we've been able or not able to really be inclusive in the responses, but maybe you can elaborate a little bit around some of the main challenges that you've seen in terms of inclusion in the response, and whether or not there were any new issues that came up around inclusion, or if it was just existing challenges that were amplified. And are there other things that we can be learning sort of moving forward around inclusion? And then maybe also, I don't know if you've seen that at all. You did mention, that it's brought out more attention to the inclusion of LGBTQI people, but have you seen organizations sort of allocating more funding or budgets to counter misinformation that's out there, or to really sort of ensure that we're getting the right information out there? Have you seen a sort of shift in the way that organizations are approaching in the way that they communicate with communities? Emily, if I could turn to you.
Okay, thank you very much. I would like to bring an appreciation.
Sorry, Francis. I was asking Emily first. Sorry. I'll come back to you, Francis.
Okay.
Thank you.
Thanks. And I mean, it's early where you are. It's about 1:15 a.m. here, so we're all operating all globally around the world. So I'll try to hold it together. Look, I mean, going back to my Internews days, the Internews manager, at least that then was that the way to defeat the challenges that been bad information is not censorship, it's more information. So, but I think there's putting more things out there in a context where there seems to be an information deluge is then problematic as well, especially in a context where we're seeing, for a whole variety of reasons, we're seeing that media organisations are shrinking. There are fewer journalists, there are fewer resources for those journalists, and at the same time, when we're talking about putting information out, we're not talking about getting information back. And so one of the things we haven't really talked about very much so far today has been the two-way dimension of communication. And I guess a different way to think about this is maybe to think about what kinds of conversations can we start, understanding that the way that the information flows through communities is not that someone reads something and then has to think about their attitudes and behaviours and then moves on, but someone hears something on the radio or listens to something or sees something on social media and talks to someone else, and that friend talks to this friend, and so what we have is lots of conversations going on, and in a sense I think to some extent we have to trust people to trust people, And so it's not about sort of us sort of manipulating them in a different way to do things that we want them to do, but to help to shape some of those conversations more effectively. To come to the question about inclusion, really, I mean, it's difficult to answer this question succinctly and also without making massive generalizations about things happening all around the planet and to a variety of different marginalized groups. But I'll have a go. I've been talking about LGBTIQ people, but women and girls, people with disabilities. You can think First Nations peoples, people who are incarcerated. There are all kinds of people who are marginalised in a variety of ways, for whom the pandemic has been an experience which has been disproportionately bad for them, whether it's in terms of the health outcomes or whether it's in terms of economic outcomes or whether it's in terms of isolation and mental health and a variety of other aspects of the pandemic. We've mentioned some of the global picture around the inequality of access to vaccines, and that high-income countries have got, I think the figure I saw was 20% more vaccines than lower-income countries. And we talk about doing things for humanitarian reasons. We can't even do things for selfish reasons. It's not good to have a large number of people in the world who are not vaccinated and potentially where other variants emerge. We can't even do things for selfish reasons, let alone for in terms of a better distribution of vaccines than because it might actually be the right thing to do. It's and beyond the vaccine inequities, the inequalities of economic recovery. For countries that have had greater access to vaccines, there's a ramping up of economies to pre-COVID-19 levels of GDP. That's not going to happen in a lot of other places for several years to come, further entrenching inequality. I mean, it's happening in the absence of marginalised people in data, in designs, in funding, in implementation of programs. I think one of the things that I was sort of reading about, sort of in thinking about today, was ways that to some extent there has been a lot of that is exacerbating pre-emergency marginalisation, as you mentioned. So just to take LGBTIQ people, people who are maybe ostracised from their families, experience violence in their families or communities, ostracised from faith communities, bullied in schools, find it hard to get jobs, discriminated against accessing public services, not part of public conversations, potentially criminalised, can't access justice. You have all of those things before a pandemic starts, and so that conditions people's attitudes, behaviours, whether it's LGBTIQ people or the way that people act toward them. I think one of the disturbing things that I was reading about in a report in terms of the impact on people with disabilities is the way that we've even gone backwards. So that one of the reports was suggesting that that there's been a move for people with disabilities to be sort of reinstitutionalized, to be significantly isolated, for people to move away from the kind of the social model that disability activists have been pushing us to adopt, and to go back to a very kind of medical and charity model. So in the stress and difficulty of addressing the pandemic, some of those better practices that have been there in terms of inclusion have been, we've sort of walked back from those in some ways. In some countries, the pandemic context has provided opportunities to increase police powers, surveillance, and the difficulties for civil society organisations. I think there's been a massive stressing of community-based organisations, which are often very poorly funded, whose funding has been badly affected by the pandemic, by donors pulling funds for projects that can't happen. Yet at the same time, those organisations are having to respond to address community needs that are not being met by governments or other actors, at the same time as the staff of those community organisations are themselves living in countries impacted by the pandemic. And I think so a lot in terms of resourcing, a lot more a lot more resources going to those organisations would be probably very, very good for inclusion. And when we take part in a variety of RCCE or accountability to affected populations, communities forums, but I tend to see a lot of very sort of traditional INGOs and actors within those platforms, and not some of the very sort of the community-based organisations that we know, for example, within the LGBTIQ community, who are actually doing the work, who are actually engaging with the communities to know whether there is accountability, to actually know what the problems are and respond more effectively. I think there are so many issues that come up, and I'll stop in a moment. But I think one interesting one that's been sort of coming up in the work that we've been doing is the increasing reliance on artificial intelligence and our algorithms in terms of the way that data is managed and is used for decision making, and the way that the data will sometimes exclude LGBTIQ people because we just don't appear in the data because no one collects data about us. But then there's also risks that the algorithms that are being used, even if we are included, are ones that might assume certain things about families, assume certain things about people that might even be used to target LGBTIQ people. And so I think there's one of the things that we don't really see very much so far, and this sort of came up in the work we were doing around people's access to cash and the way that data is used to in some decision making around cash-based assistance, is that we don't see very much in the way of safety or inclusion guidelines being operationalised in terms of the way that organisations are using data. Maybe the last thing I'd throw in here is that, I think in terms of inclusion issues, there's sometimes a temptation to see them as programs issues. It's like, well, we have to respond to this. At the same time, organisations themselves have not actually started to walk the talk on some of these inclusion issues internally. Many humanitarian development organisations provide no training for their staff on LGBTIQ issues. They haven't adapted their own tools and policies to be inclusive of LGBTIQ people. They don't think about, say, for example, programs for women and girls, and think, well, actually, lesbians and bisexual women and trans women are women and girls, so we could be using women and girls programs to address these issues. So all of those kinds of preparatory things haven't happened, and then all of a sudden we want to address inclusion as a programmatic thing. There was data that I saw during a project last year that the vast majority of LGBTIQ people within humanitarian organisations don't come out because they fear that they won't be, that it'll be used against them in terms of deployments. So if these kinds of issues are coming up within organisations, our chances of actually doing inclusive programs work are very minimal. So the pandemic has raised a plethora of inclusion issues. I don't know how well I've done in summarising those, but hopefully that someone will find a hook there.
I think you did a great job, Emily, and I do think that point you also made about how some of the good practices we have taken a step back under COVID is something that we all need to be very concerned about, not only in terms of persons with disabilities, but if we also look at gender-based violence, for example, and how that has become a shadow pandemic, particularly for women and girls, but not only. I think it's something that we really need to be thinking about. How do we really address some of these backward steps that have been taken under COVID? Also in terms of civil liberties, the way that governments are, imposing things, potentially shutting down of asylum in certain places, refugees not being able to get to seek asylum. And I think there's going to be a lot of reckonings for us as society generally, or, in populations in different countries that I think we're going to have to address. But I want to try and get us to focus a little bit on some of the lessons that we can take from the COVID pandemic more broadly around accountability and inclusion. And I know we've touched upon many of those already, but wanted to maybe see if we can unpack those a little bit in our last 28 minutes that we've got left. I think in terms of some of the tools around risk communications and community engagement, I wanted to turn to you, John, and Amaya, and then Francis, I'll come back to you because I know you've got some as well. what are some of the tools that you've seen that have, or were there any new tools that were developed that you've seen that could be useful outside of the COVID pandemic that we could use more generally in humanitarian response? And maybe also to pick up on that point, Emily, that you made earlier around how we're not engaging enough with community-based organizations. Are some of those tools ways that we might be able to better engage community-based organizations, or that could be useful for them as well? John, maybe I could turn to you, and also maybe John, if you could also, I don't know, given the digital side that you were talking about, the point that's come up before also is that we haven't figured out how to use the algorithms out there and the artificial intelligence. Are there things that we should be doing better as humanitarians to try to tackle that elephant that's out there as well around the digital side of things? Just a few easy questions for you.
Yeah, thanks, Manisha. It's hard to come after all of the discussions we've had around everything ranging from vaccine inequality to global poverty and beyond, and to come back to digital tools for risk communication, community engagement. However, I will try and join the loops together. I think briefly to speak on the last part, and you had a question around, does the complex circumstance in which we're operating, how does that filter with COVID? Essentially, it's like a lens. That's the way I see it. And actually, with UNHCR, and this I think is really key to essentially the protection dimension of all the work that we're doing, is that you're not necessarily going to have answers or solutions for people with the way that we communicate. And Emily's point around needing to bring this to a conversation around two-way communication is really critical there. And that, I think, is one of the key ways of addressing or thinking about this, and something that we as UNHCR put a lot of time and thought into at the beginning of the pandemic. And this is my sort of bridge and segue to the digital tools, is that we realized that they are an important channel for two-way communication. I mentioned the guide earlier about social media, but there's also opportunity through messaging apps to build these more direct engagements with individuals rather than in a public sort of sphere, which many social media platforms provide. And specifically, the innovation service in UNHCR with the Division of International Protection and others developed a project using WhatsApp to engage with communities. I'm sure there might be some eye rolling in the audience there. We're happily able to share a blog that it can actually explain that this was a complicated task because we had to find a middle way in ways that balance the rights to privacy and the way that people's data is protected with the need to engage with communities meaningfully and proactively through such platforms where they're already really active. And we know from many information in communication needs assessments that WhatsApp is one of the most highly used tools amongst the communities. And yet the actual humanitarian presence on the platform and the way that they utilize that is very nascent, very ad hoc, and not systematized. And that's something we thought we could turn on its head. So we've established this partnership with an organization called Turn.io to build out a WhatsApp solution. I think my colleagues are sharing some videos and some resources in the chat. But exactly these types of solutions are pilots, are learning exercises, not only valid for UNHCR, but for the wider sector. We want to be really transparent about the challenges that we've faced in doing this and addressing some of these issues. A lot is touted about artificial intelligence. Yet, that relies on you having not only the models and algorithmic models, but the training data in the languages that we're talking about. Somebody mentioned translations and so on in the chat. That's still a really big barrier to having emerging technology like artificial intelligence really supporting some of the communication dimensions we're building out with these new technologies. I think it is an important opportunity, though, because we've seen and we've had up to over 30,000 users engaging with us through these WhatsApp channels, that it's possible to actually use this to build not only an information portal, but actually build meaningful two-way transactions with people. And the critical lesson that we've learned here is that it's not just something where you can flick the switch, turn it on and leave it. You need to invest in it. You need humans to invest in it. And one of the really interesting findings that we found as UNHCR was the staff that we had were using these digital channels to engage with people were actually happier in their jobs, funnily enough, than those who maybe weren't as close to communities through the pandemic or weren't able to have that interaction. And they wanted to provide that support. And just to maybe pivot back to the inclusion point quickly before closing, is that I think we do see a lot of opportunities with digital technology to enhance accessibility. Now, that's obviously only one dimension. And I think we are learning, as Emily's saying, how, maybe things that don't work or trial and error and so on. But I think the actual opportunity that's afforded to us through this is actually really great if we're willing to grasp it, willing to listen to communities. And one of the things that we did through this process was, we didn't just sit in Nairobi, where I am, or Geneva, and say, hey, let's build the chatbot. We actually worked on iterations. We're engaging with communities at each of the locations. We started off with 5 pilot countries, but speaking with them, working with them through that, and taking a human-centered design approach to that, to make sure, is it answering the questions that they wanted answered? And really listening to them at that level in the construction and design, not only after the fact consultation. And I think that's something that, has been a running thread, at least in the vernacular within the RCCE and AAP space for many years. But I think humanitarians are really starting to clop onto that now, and the need to utilize innovative methodologies in actually the solutions they develop, to really stress our accountability credentials through that process, to make these services work based on what people are telling us rather than what we think is best for them.
Thanks, John. And your colleague, Catherine, I think has put, definitely it's Catherine, I think she's your colleague, has put in some links right when you were talking about the WhatsApp work that you were doing, as well as a blog around key findings from engaging communities through messaging apps. So thanks for that, Catherine. I think some more useful tools and resources there. And I think, as you said, those digital tools are a potentially great way for inclusion, but I think we still have a long way to go in terms of the different languages, interpretation, how we make that all work. Although I have seen leaps and bounds of how we've been able to bring in interpretation into platforms like Zoom since the beginning. I remember, since the beginning of COVID, sorry. I remember trying to set up interpretation, having a really hard time back in March 2020, and I think things have gotten much smoother. So I think we're making strides, but I think we still have quite a long way to go still, for sure. Maybe, Francis, I can come to you, and then Amaya, I'm going to come to you, because Francis, I know that you had some tools that you wanted to talk about around how you've been using them in terms of COVID that could be applicable outside of the pandemic. But Francis, I also wanted to see if you could talk a little bit more about working with the government. You'd mentioned about the Ministry of Health and how you had a very close relationship in terms of the communications that you had there. Are there some lessons from that as well? And were there any particular challenges that you had that you may need to, that could be good lessons for us in terms of moving ahead in terms of accountability and inclusion and communicating with communities? Francis, if I could pass to you, please. And then Amaya, I'll come to you.
Okay, thank you, Manisha. And what I want to share here is that the availability of the 16 ambulances that are prepositioned by the Ministry of Health supports...
Can I be super rude? I just saw a message from Amaya saying she has to leave in 5 minutes. Do you mind if I go to Amaya first for a few last words, and then I come to you, Francis, before she goes? Thank you, okay. Thank you, Francis. Sorry, Amaya, I just thought that.
Oh, no, I feel bad, Francis. I better make this good, huh?
So, Maya, any tools on your side that you've seen that we can be using, or just other general lessons that you've got before you have to head off for other responses and communicating with communities?
Thanks. So again, I think maybe John's covered it quite well on the digital side. I think that is the area where we could be working, but it hasn't been our strength. But I do think we're getting there with that. But having said that, we did have we used chat bots, we used some AI for that. So there are some sort of rudimentary signs that we're going to be able to use it. But I think some of again, a lot of the things are not necessarily new, but it was good that we got things going quickly. And I think the data is actually the issue there. Like, as I said before, we got a lot more data that's behavioural. I think the next step in that challenge is for us to be able to use it. And again, I do think that's a digital solution that we're looking for, because we now have data, but we can't churn through it quick enough to actually be able to use it in real time, with the exception of the social listening platforms, which again, I think those platforms are much better at providing us a real-time analysis. And again, it's more AI. So it still does require a bit of human contact to really get the best out of it. But even so, we're not quite utilising the data as we should. But I do think that's an area where we have really made really good progress in this particular pandemic. And I guess the last thing I'll say is about the dashboard. So there's actually a plethora of dashboards as well that we haven't really had before, and particularly on the behavioural side, we've never really had behavioural dashboards, but we now do have a couple. I guess the next level in that regard would be for us to be able to triangulate. There's a epidemiological model 101, which talks about host agent environment. And what we've seen in this pandemic is, and what we often see is we get a lot of data that's around the science, which is really the agent, in this case, the virus. And so we get showered with that scientific heavy information that's absolutely necessary. And we've had really great epidemiology. And in fact, we've simplified that. The community knows what epidemiology is all over the world now because of that. So I think it's been good and bad. But the balance hasn't been there, because the other two things, if that's the agent, the host is us, the human. And we haven't actually had the same level of attention to data about human behaviour, the behavioural data, the knowledge, the attitudes, the values, what motivates us, things beyond COVID, as I think Franklin said before, things that are important to us that have to be taken care of before we can think about vaccines. In our region, Lebanon's had an enormous number of events that, it's very hard to talk about vaccines, or Sudan at the moment, or Yemen at almost any time, or Syria, I just came back. It's hard to just pick out vaccines and not address the other things. So I do think, and just the third thing, when I say host agent environment, the environment is the policy environment. And we have seen governments being really quite agile in policy adjustments, but you don't see these three things layered or compared, or you don't see them in real time, so you can't really make, and plus there's delays in when you implement a policy, and then you see the benefit of it a little later. But this idea of bringing these different forms of data together, I think we've done a great job in having more of it available. But the areas now are about utilising it, and actually about integrating the data so that we can truly manage this supply and demand side of the issues. So thanks, everyone, and I'm very sorry I'll have to leave, but I really appreciate all the comments from all the panellists. And Frances, I'm in your debt. Over to you.
Thanks so much, Amaya, and really great to have you on the panel. And I think those points around how do we use all that data is something that we're really going to have to tackle, given that there is now so much data, and how do we really make sure that we're using it. Frances, I'm going to turn back to you, and then Franklin, I'm going to come to you for the last intervention before I give the rest of the panel maybe 1 minute for final words. But Frances, can we come back to you, and thank you again for letting Amaya jump in there. I apologize again, but thank you for your flexibility.
Thank you, and much appreciated. I know time is not an ally, but I principally have two things that I thought I need to bring across. Like I was saying, that currently we have 16 ambulances that are pre-positioned in the respective areas in the country, and these ones support evacuation of cases that cannot be managed at home, and then they are meant for referrals to the nearest health centers for further management. But even besides that, we have what we call the community engagement strategy. This is a strategy which was launched by the government of Uganda, but Uganda Red Cross is taking lead in the implementation, and we are working with what we call the village COVID task forces that specifically support home-based care, and then they also do disease surveillance, and then they do the door-to-door mobilization, especially for vaccination as for now. Yes, we are endeavoring into all this, but we cannot run away from the challenges, because even as these volunteers are supporting these activities, we still have a deficit in provision of PPEs, and then also aspects of communication. Sometimes some areas in the villages, you cannot have a telecom accessibility, so there is still struggling. And then there has been an effort by government also to deliver masks, but apparently they have not fulfilled to what was expected. So there is laxity in the persons at the moment observing SOPs. So we have to continue to be on the outlook, because we are not prophets of doom, but we can't know when wave 3 comes. Over to you, Manisha.
Thank you, Francis. And I think that's great that you've been working so closely with the government, and I think some of those lessons are turned to you maybe as our last sort of response to a question, and then I'm going to give everybody 1 minute for any last thoughts, or 30 seconds actually. But Franklin, in terms of some of the coordination challenges that you've seen, as we just heard from Francis, working very closely with the government, not necessarily something new, but perhaps the ways in which there was that close relationship around the kind of engagement strategy. How have you been approaching some of the coordination challenges that have come about from some of the new ways that people have been forced to work together? And is there something that you would take as a lesson that we should be replicating in future responses, particularly around communicating with communities and engaging with communities?
Okay, we had two big challenges in coordination wise. So the first one was on the number of people, new partners coming in, the RCCE coordination. So we started with around 6 partners organizations, and it soared from 6 to 27. So we have in the meeting, for example, we had around 50 people. So COVID-19 is social distancing, so we cannot hold the meeting with 50 persons. So what we did, I think we can keep doing this even beyond COVID, is to restructure the coordination body. So we had the subgroup, we create the subgroup radio, subgroup communication material, subgroup feedback, and subgroup and another subgroup social media. So in each subgroup, we speak 10 for each subgroup, and they was taking their meeting every week, once a week. And the coordination, the RCCE was just the head of each coordination coming in and talking about what's going on in subgroups. So that structure really helped us to be effective, and at the same time to take into account the COVID-19 constraint. That's the first one. The second one, and rapidly, is the big switch, because before COVID was working in the YASC cluster system, and with the RCCE, the leadership was with the government. So from the YASC coordination structure, we moved to the government-led coordination structure. And there, the situation and the way they're doing business is completely different. So we need to adapt. And the problem also is that the government doesn't have the experience coordinating humanitarian. It was really tough. So what you have done is to create beside that organization, that coordination led by the government, we create a task force, humanitarian task force, where all humanitarian, we come together, cluster WASH, cluster health, and all those implementing partners, we come together, we coordinate before we go to the meeting with the government. So in that way, the coordination was much more effective. And what we was doing in the field in terms of collecting feedback, trending them out, we can feed them directly to the task force instead of to the government directly, because the government sometimes don't really take into account feedback coming from community. They just go straight doing their business. So that is the way we get around the challenging in coordination. Thank you.
Really interesting, Franklin. Thanks for that. And I think that way that you were able to adapt the coordination structures as a lesson for us potentially to take forward is super interesting. And I don't know, I think that the way that you had the humanitarians come together and feed into the government, I think is probably a really good lesson also in situations of conflict where the government is a party to the conflict, and making sure that we can maintain and protect our humanitarian principles of independence and impartiality in those sort of situations. before I do a little wrap up and talk about our next webinar, I wanted to come back to all of you for a last 30 seconds. Any last lessons that you'd like to share with us from COVID that you would take forward around risk communication and communicating with communities, or anything around accountability and inclusion that you want our attendees to take home with them? Emily, maybe I can start with you, then John, Francis, and Franklin, if I could, please. Emily.
Sure. So I think one of the things I think is interesting is that issues around lack of inclusion and RCCE issues have been issues in high-income countries, including places like Australia, as much as they have other parts of the world. And if I think about Australia, we have a truly woeful record in terms of the health outcomes for Aboriginal and Torres Strait Islander people in this country, along with a broader range of civic, political, and economic rights development issues. But what has worked is where the government has stepped back, has trusted Aboriginal communities and health leadership within those communities to address issues in the ways that make sense for them. Where it hasn't worked is where more, and that was more recently, where more of a sort of a command and control, top down kind of approach has come back into the picture. So maybe the lesson there is that working with community groups and with what works, building on what works rather than trying to impose things, is a great idea.
Great lesson. Thank you very much, Emily. John, last lessons from you, or last words, please.
Thanks, Manisha, and thanks everybody for attending and spending time with us today. From my perspective, the real takeaway is that innovation in the space of risk communication, community engagement is so pressing, and that people really need to do it. Experiment and learn and share that learning. Be radically open with your findings. Be open to talking and working with others around that. And I think that the only way that we're going to be able to adapt our models and our coordination, collaboration around all of these really nascent, emerging, challenging issues that impact not only our work in sort of humanitarian response or and development, but actually our general lives. And really only by doing this together can we do that. So I encourage everybody to go away, innovate, experiment, take risks, and work with others. Thanks everybody for joining.
Thanks so much, John. Excellent lesson for us to all take home. Francis, over to you, please, for last words, last lesson.
Thank you, everyone. Thank you for accepting me to participate in this webinar today. My take home is, for purposes of breaking prejudice, we need to do a lot of taking of success stories so that we can use them as learning points and experiences also that can be shared with those persons that are still bent to stigmatization and having untrue and uncollated information towards the aspects of prevention and responding to COVID-19. Thank you.
Super. Thanks very much, Francis. I think that's also learning from each other and our successes is definitely critical. Franklin, last word to you before I do a quick wrap up and next steps. Please.
Okay, thank you so much. I think the takeaway today is really to show, and I come back again on this, to learn how we can show, how we can capture some key emotion that drive people behavior and adjust our community engagement strategy. That is key, mostly in the RCCE operation, because we are dealing with health issue, and the health issue is about the life of people. And I think we need to put this together and to make it maybe a new way of doing business, and even to bring it in our AP, traditional AP, with our traditional humanitarian interventions. Thank you.
Super. Thank you so much, Franklin. And a huge thanks to all the panelists for what's been a really interesting conversation for me personally, but I hope also for all of you in the audience, and thanks to all those in the audience as well for all your questions and comments and sharing of resources. I think we've had an incredibly rich conversation, starting with where we started with the challenges around COVID. We had some preparedness, but it did surprise all of us. We've had to really change the ways we've worked, moving from face-to-face to having to deal with digital tools and adapting much more quickly than we ever expected, going from something that many of us thought was a great thing to have, but realizing that we really needed to up our game in terms of how we use digital tools to really engage and communicate with populations. But we also saw that we're not necessarily really understanding what are the best ways to communicate with communities all the time. We really need to be working much more with community-based groups, also working with government to understand what are the best forms of information that people will trust. I think those issues around mistrust, misinformation are challenges facing all of us in society. But I think particularly as humanitarians working with communities, how do we make sure that we are identifying ways of communicating with communities that they use, that they trust, and that are also being done in ways that are building on their lived experiences, that we are taking the time to understand what it is that people are going through, really expressing that humanity and that compassion that, Franklin, you talked about at the beginning. And I think working, as you said, Emily, really with community-based groups that are already out there, and how do we really bring them in as we move forward into our work on accountability and inclusion. I think one of the things we've really seen with the COVID response is that community-based organizations are often at the front lines, but as humanitarians, we often talk about localization, working with them, but it's really causing us and forcing us to think, how do we do that in a much better way? So when we're talking about risk communication and communicating with communities, that we're trying to do it in much better ways. I think we've seen also lots of new tools or tools that have been adapted that we can be taking forward in RCCE, but also more generally in terms of accountability and inclusion, and some good lessons around how do we better coordinate with government, as you talked about, Francis, and adapting our coordination structures, Franklin, as you spoke about there. And I think also really dealing with all that data that we've been able to gather also in terms of the behavioral aspects. How do we use all that, and how do we make sure that we're adapting the data and changing? And I think, how do we share our lessons in a very open way, as you pointed out at the end there, John? We're all learning all the time, but we often have our institutional barriers up, and we need to find ways to be much more open so that we can collectively learn how to do better when communicating with communities and engaging them on risk communication. Huge thanks to the panel. Our next session, I want to make sure that you're all around for that one, is on Tuesday, December 7th. I think we've got the 2nd of November link, so we're going to get the correct links dropped into the chat. That session is going to be focusing on accountability, complaints and feedback mechanisms, making much needed changes, and that is on Tuesday, December 7th. And I hope that you will all join us for that. A final thanks to all our panelists. Once again, you've been very insightful, and I really appreciate it. Thanks to our participants, as well as Kelly for captioning, as well as the IAC reference group for co-chairing this with PHAP. So thank you very much, and I wish you all a lovely day, night. Emily, thank you for joining us so late in your day, particularly, but thank you, Francis, Franklin, John, and Amaya, and Emily for being on our panel today. Have a good day or evening. Thanks all.